Good evening, friends. How are you? Are you fine? Happy Independence Day to all. A very happy Independence Day to all. Are you fine? Now I am going to start pathology, top MCQ questions of medical lab technology. Are you interested? So that I can start top MCQ questions of pathology. So let me start. Now I will be sharing my screen. Happy Independence Day to all my friends. Today I will be solving top pathology MCQ questions which are very much helpful for your medical lab technology or upcoming competitive examinations. So are you interested in these questions? So the first question for today's session is anemia is defined as. So can you tell me what is anemia? What is the cause of anemia? Can anyone tell me what is the cause of anemia? Anemia is the decrease in hemoglobin concentration. Okay. So what is anemia? Anemia is caused by decrease in hemoglobin concentration in our body. So what is hemoglobin? Hemoglobin is a iron containing protein in our body which is red in color. Okay. So the next question is, The most common nutritional anemia worldwide is. So, what is the most common nutritional anemia worldwide? Can you please answer me this question in the chat box? So, can you try to answer me this question? So, please like and subscribe my session so that I get motivated to bring more such live sessions for you. So, the answer of this question will be iron deficiency anemia. Okay, so anemia is caused when there is an element named iron. When it is low in our body, then anemia is caused, and you have to remember it. Okay, so now in the next question is given as iron deficiency anemia is usually which type of anemia? Iron deficiency anemia is microlytic hypochromic. The answer of this question is microchromic macrocytic hypochromic anemia. So now the next question is given as pernicious anemia is caused by deficiency of. Can you please answer this question for me? What is the cause of pernicious anemia? By which deficiency of which vitamin? The deficiency of which vitamin causes this anemia? Vitamin A, vitamin C, vitamin B12, and vitamin D. Can you please answer this question for me? And the right answer of this question will be vitamin B12. Vitamin deficiency of vitamin B12 is the main cause of pernicious anemia. Okay, now we will move to the next question. Here the question is given as megaloblastic anemia results from deficiency of. What is the cause of megaloblastic anemia? Megaloblastic anemia is caused from the deficiency of vitamin B12 and folic acid. Okay, so what is the cause of megaloblastic anemia? Megaloblastic anemia is caused by the deficiency of vitamin B12 or folic acid. Vitamin B12 is also known as folic acid, and its deficiency causes megaloblastic anemia. Now, I will move to the next question. Here, the question is given as the normal hemoglobin level in adult female is approximately. So, what is the normal hemoglobin level in adult females? Can you please answer this question for me? The answer of this question will be 12 to 16 gram per dl, mg per dl. That is 12 to 16 mg per dl. Okay, this will be the right answer. So what will be the right answer of this question? 12 to 16 mg per dl. Okay, now I will move to the next question. So the next question is given as, what is the meaning of reticulocyte? So the reticulocytes are immature red blood cells. So what are reticulocytes? Reticulocytes are immature red blood cells. Okay, so what do you mean by reticulocytes? Reticulocytes are immature red blood cells. I think you are finding this question very much interesting. So please like and subscribe my channel so I get motivated to bring more such videos for you. So here the next question is given as, which test measures the percentage of RBCs in blood? So by performing which test we can measure the percentage of red blood cells in blood? Red blood cells. Red blood cells are also known as erythrocytes. Okay, erythrocytes. So what are red blood cells known as? Red blood cells are also known as erythrocytes. So by performing PCV test, that is packed cell volume, or hemocrit test, we can find out the percentage of red blood cells. Okay, so by performing which test we can measure the percentage of red blood cells in the blood? If anyone asks you, you just tell them by performing packed cell volume test, that is hemocrit test, we can measure the percentage of red blood cells in the blood. Okay, so now the next question is given as, polycythemia refers to. So what do you mean by polycythemia? Polycythemia means increase in red blood cells. Increase in red blood cell count. Okay. So what does polycythemia refers to? Polycythemia refers to increased in red blood cell count. So now the next question is given as, sickle cell anemia is caused by. So what is the main cause of sickle cell anemia? Can you please answer me this question? What is the main cause of sickle cell anemia? The main cause of sickle cell anemia is, it is abnormal hemoglobin in our blood. Abnormal, hemoglobin, hemoglobin in our blood. Hmm. Now we will move to the next question. I am as very much assured that you are finding this question very much interesting, and I guaranteed you this will be very much helpful for your coming examination. So please like and subscribe my channel if you like to get more such live streams and videos, because this will be very much helpful to you in your coming examination. Okay, so please like this video and subscribe my channel. So here the question is given as the next question is given as the sickle cell trait is inherited as. So what is the main cause of sickle cell? Can anyone answer me this question? What is the main cause of sickle cell? The main cause of sickle cell is autosomal recessive. Okay, so the sickle cell trait is inherited by autosomal recessive. Okay, we have to remember it. These are very much helpful questions for your upcoming examination. So here the next question is given as thalassemia is caused by. So what is the cause of thalassemia? Thalassemia is caused due to hemoglobin synthesis. So what is the main cause of thalassemia? It is hemoglobin synthesis. Okay. So here the next question is given as which organ removes old red blood cell from circulation? So can you please help me with this question? Which organ helps us to remove old blood cell from circulation? Please try to answer this question. So please like and subscribe my channel. If you like this live stream, I will get motivated to bring more such live streams for you. And these live streams will be very much helpful for your coming examination. Okay, and please share this with your friends and family so that they can also get benefited from these live streams. Which organ removes red blood cell from circulation? The answer of this question will be spleen. Spleen is a organ which helps us to remove old red blood cells from circulation. The next question is given as bilirubin is mainly formed from the breakdown of. So, what is the main cause of bilirubin? So, bilirubin, how is bilirubin formed? Here the question is given as bilirubin is mainly formed from the breakdown of. Can anyone help me to answer this question? Bilirubin is caused mainly due to breakdown of hemoglobin in our body. Okay, so bilirubin is mainly formed from the breakdown of hemoglobin. So here the question is given as leukocytosis means. What do you mean by leukocytosis? So, from the term leukocyte, we know that leukocytes are known as WBC, that is white blood cell. Leukocytes are known as white blood cells. So, leukocytosis means increase in white blood cell count. Okay, I think you are finding this question very much interesting. Please give me a thumbs up in the chat box. Here now, here the question is given as leukopenia refers to. So what is known by leukocytes? Leukocytes are known as WBC. Leukocytosis means increased in white blood cell count. Now leukopenia means decreased in WBC count. Okay. So what is leukopenia? It is decrease in WBC count, decrease in white blood cell count in our body. Okay. Now, which WBC is responsible for antibody mediated immunity? Here, the right answer of this question will be B lymphocyte. So, which WBC is responsible for antibody mediated immunity? The right answer of this question will be B lymphocyte. Now, in the next question, now we will move to the next question. Okay, so the next question is given as which white blood cell is mainly involved in cell mediated immunity? The right answer of this question will be T lymphocyte. What will be the right answer of this question? It will be T lymphocyte. I think you are very much clear with the answer. So, which white blood cell is mainly involved in cell mediated immunity? The right answer of this question will be T lymphocyte. Now, I will move to the next question. The next question here is given as the largest circulating white blood cell is. The right answer of this question will be monocyte. Okay, so the largest circulating white blood cell in our body is monocyte. Now I will move to the next question. Here the question is given as basophils releases. So what does basophil releases? Basophil releases histamine and heparin. So what does basophil releases? Basophil releases histamine and heparin in our body. Okay. So here the question is given as acute leukemia is characterized by prolifer- proliferation of. So, what do you mean by the term proliferation? Means proliferation means increase. So, acute leukemia is characterized by increase of. So, what causes acute leukemia? Acute leukemia is characterized by proliferation of mature cells. Now, blast cells. Sorry, it will be blast cells. I think you are very much clear. So now I will move to the next question. So here the question is given as chronic myeloid leukemia, that is CML, is associated with. So what is the main cause of chronic myeloid leukemia, that is CML? The main cause of CML is option number A, that is Philadelphia chromosome. Now I will move to the next question. Now the next question, I will move to question number 78, and here the question is given as vitamin K is essential for synthesis of. So, vitamin K is very much essential for the synthesis of clotting factors 2, 7, 9, and 10. Vitamin K helps in the synthesis of clotting factors 2, 7, 9, and 10. I think you are very much clear. So, what does bleeding time assesses? Can you answer this question for me? What does bleeding time assesses? Means why we find out the bleeding time by performing BT test. Can you please answer this question for me? It is used to assess the platelet function in our body. Platelets are also known as thrombocytes. That is, it helps in clotting. Okay, it helps in clotting of blood. So, bleeding time mainly assesses the platelet function of our body. Now, what does clotting time evaluates? Clotting time evaluates the coagulation pathway. Okay, so what does clotting time evaluates? Clotting time evaluates the coagulation pathway. I think these questions are very much clear to you. Are you finding this question interesting? Please give me a thumbs up in the chat box, and please like and subscribe this channel so that you can receive more such videos which I am going to bring in the near future, and this will be very much helpful to you in your upcoming competitive examinations. So please like this live stream. Okay, Now here the question is given as the intrinsic coagulation pathway is assessed by APTT test. So what is the full form of APTT test? APTT. The full form of APTT test is activated ACTIVAT activated partial thromboplastin test. So what is the so the intrinsic coagulation pathway is assessed by activated partial thromboplastin test, that is APTT test. I think this question is very much clear to you. Is it clear? If you have any problem understanding these questions, then you can definitely ask me in the chat box. I will answer you. So the next question is given as prothrombin time evaluates. So what does prothrombin time evaluates? I think prothrombin time evaluates extensive pathway. Okay. So what does prothrombin time evaluates? Prothrombin time evaluates the extrinsic pathway. Okay. Now I will move to the next question. Here the question is given as fibrin is formed from. Fibrin is formed from fibrinogen. You can find the answer in the question itself. Here the question is given as fibrin is formed from. So where does fibrin is formed from? Fibrin is formed from fibrinogen. So I will move to the next question. The next question is given as the final step of coagulation in the conversion of the final step of coagulation in the conversion is the conversion of fibrinogen to fibrin, and it is the final step of clotting of blood. Are you finding this question interesting? Please let me know in the chat box. So here the question is given as which anticoagulant is commonly used for coagulation studies. So here the question is given as which anticoagulant is commonly used for coagulation studies, and the right answer of this question will be sodium citrate. Okay, and the vial and it is blue top vial, blue top vial. Okay, now I will move to the next question. And the next question is given as the RH factor is also known as the RH factor is also known as D antigen. D antigen. So what does the RH factor is known as? The RH factor is also known as D antigen. These are very much important questions for your examination. I guarantee you. This will come in every competitive examinations and we should practice it together because we know that sharing is caring. We should share this live stream with everyone, with your family and friends, and every day we should practice together and have some discussion among ourselves so that we together can crack any competitive examination in our future which is related to medical lab technology. So please like and subscribe this channel and this live stream. Okay. So here the question is given as which blood group has both A and B antigen? So can you please help me to answer this question? Which blood group has both A and B antigen? The right answer of this question will be AB. AB blood group has both A and B antigen. Okay. So here the question is given as which blood group lacks means which blood group do not contain any A and B antigen. And the right answer of this question will be, can you please answer this question for me? Which blood group do not contain A and B antigen? Please try this question to answer. Please try to answer this question. I am giving you 30 seconds. The right answer of this question will be blood group O. Blood group O lacks A and B antigen completely. Means blood group O do not contain any A and B antigen. Okay. Now I will move to the next question. So cross matching is performed before. So when we do cross matching of blood, cross matching is performed before blood transfusion. Okay. So cross matching is performed before blood transfusion. The universal plasma donor is which blood group? Which blood group is universal donor? The universal donor is blood group AB because it does not contain an because it does not contain antibody A and antibody B. So it is the universal donor. So here the question is given as bone marrow aspiration is commonly taken from D. The bone marrow aspiration is commonly taken means the sample of bone marrow is taken from, it is taken from posterior iliac crest. Okay. So where the sample of bone marrow taken from bone marrow aspiration is taken from posterior iliac crest. Okay. So now I will move to the next question. The normal color of plasma is the normal color of plasma is yellow. That is straw colored. It will be pale yellow. Okay. I think you are finding this question very much interesting. Which strain is used for peripheral blood smear? Which strain is commonly used for peripheral blood smear? The strain which is used for peripheral blood smear is Leishman strain. It is Leishman or Leishman strain. Okay. So this right answer of this question will be option B. That is Leishman strain. Leishman strain is used for peripheral blood smear. So ESR, what do you mean by ESR? ESR means, I will write it for you. ESR is erythrocyte. ERYTHROCYTE. Erythrocyte sedimentation rate. So now ESR is commonly increased in. So when we find a increase in erythrocyte sedimentation rate, we find erythrocyte sedimentation rate, we find increase in ESR when there is chronic inflammatory disease. Okay, when there is chronic inflammatory disease. Okay. Mm. Now here the question is given as pancytopenia means reduction in. What do you mean by pancytopenia? Pancytopenia means reduction in red blood cell, W white blood cell, and platelets. The word penia means reduction. We should remember it. Okay. The word penia means reduction. And what is the meaning of pancytopenia? Pancytopenia means reduction in red blood cells, white blood cells, and platelets. I think you have understood this question. What is the meaning of penia? Penia means reduction. And what is the meaning of pancytopenia then? Pancytopenia means reduction in red blood cell, white blood cell, and platelets. Okay. Here the question is given as the normal lifespan of platelets is approximately. What is the normal lifespan of platelets? So what is the normal lifespan of platelets? The normal lifespan of platelets. It is 7 to 10 days. Okay, the normal lifespan of platelets is 7 to 10 days. Normal lifespan of platelets is 7 to 10 days. What is the normal lifespan of red blood cell? The normal lifespan of red blood cell is 120 days. Okay. Here the question is given as which organ stores a significant number of platelets? Can you please help me to answer this question? Which organ stores a significant number of platelets in our body? Which organ stores significant number of platelets in our body? The right answer of this question will be spleen. Spleen is an organ in our body which helps us to store significant number of platelets. So here the question is given as the best screening test for anemia is. What is the best screening test for anemia? Means which test is best for detection of anemia out of this four test? The best screening test for anemia is hemoglobin estimation, because we know that a reduction in hemoglobin causes anemia. Reduction of HEMO, hemoglobin, in our body causes anemia. Okay. So what is the cause of anemia? Reduction of hemoglobin in our body causes anemia. So which is the best test to find or to detect anemia in our body? It will be hemoglobin estimation. If there is a reduction of hemoglobin in our anemia in our body, then it causes anemia. Here the question is given as the branch of pathology that studies tissue changes. The answer of this question will be histopathology. So the branch of pathology that studies tissue changes is known as histopathology. Okay. So I think you are finding this question very much interesting and it will be very much useful to you in your coming examination. So please like and subscribe my channel and please press the bell button so that whenever I come live with a session like this, you will definitely receive the notification promptly and you will come in my live sessions so that you can gain some knowledge from it. It will be very much helpful to you in your coming examination. So please like and subscribe my channel. It is an earnest request to you from my side. So here the question is given as cytology is the study of. Cytology is the study of individual cells. Okay, it is not the study of blood cells, it is the study of individual cells. So what is do you mean by cytology? Cytology means the study of individual cells, and you have to remember it by heart. So here the question is given as which method is commonly used to diagnose cervical cancer? Can you please help me to answer this question? The method which is used to diagnose cervical cancer is pap smear. Okay, pap smear is a method which is commonly used to diagnose cervical cancer. So the next question is a biopsy is a what is a biopsy? What do you mean by biopsy? What do you mean by biopsy? Biopsy means removal of tissue for microscopic examination. So, what do you mean by biopsy? Biopsy means removal of tissue from microscopic examinations. Okay, now I will move to the next question. Here, the question is given as which fixative is most commonly used in histopathology? The fixative which is used in histopathology is formalin 10% neutral buffered formalin. Okay, so what is the name of fixative? If someone asks you, you just answer them. Formalin 10% neutral buffered formalin. बस हो गया और कुछ नहीं बोलना है. So here the question is given as the most commonly used strain in histopathology is it is hematoxylin and eosin strain, that is He strain. So which strain is used in histopathology? It is hematoxylin and eosin strain. Okay. So here the question is given as dysplasia refers to dysplasia refers to disordered growth of cells. So what does dysplasia refers to? Dysplasia refers to disordered growth of cells. Okay. So my last question for this session will be which condition is considered a pre-malignant lesion? So which condition is considered as pre-malignant lesion? The answer of this question will be all the above. That is mild dysplasia, severe dysplasia, and carcinoma in situ. Okay, so the conditions which are considered pre-malignant lesions are mild dysplasia, severe dysplasia, and carcinoma in situ. Okay, thank you for giving me a patient hearing. Please like and subscribe my channel so I can bring more informative and helpful videos for you. It will be, I assure you, these videos will be very much helpful for your upcoming examination. Well, now, when later when I will bring my pathology MCQ questions, I will bring questions from the next number, that is 109. So thank you so much for giving me a patient hearing. Now I am signing off from this live session. Thank you so much. Love you all. Happy Independence Day. Jai Hind. Thank you.